Welcome to the Washington State Pharmacy Laws for Technicians webinar. My name is Jenny Arnold, and I am a Washington State licensed pharmacist. I have worked in a variety of practice settings, and am now the Director of Practice Development for the Washington State Pharmacy Association. I will be the lecturer for this series of law courses. Before we start, I would like to say a big thank you to Dr. William Fassett for helping to put together this learning material for technicians. I would also like to thank Hung Lee and Tanya Karwacki for their help as well. As we get started, it's important for you to review this disclaimer. The instructors of this course are pharmacy practice professionals who have pharmacy education and experiences. However, we are not attorneys who can offer advice or services. If you do need legal advice, please seek the services of a professional licensed attorney, preferably one with pharmacy law experience. Also, care has been taken to assure the accuracy of the material as of the revision date at the end of each chapter. Users should verify with available official sources the current status of any law or regulation cited pertinent to your practice. These are the resources that were used to put together the course information and will serve as good resources to you if you need them. You can refer to the Washington State Pharmacy Association website for a copy of Washington Pharmacy Law, a User's Guide, which is a comprehensive textbook of Washington State pharmacy practice law. Also, the Washington State Pharmacy Quality Assurance Commission website has the most up-to-date copy of the pharmacy law book. By the end of this course, pharmacy technicians should be able to describe the powers and duties of the Washington State Pharmacy Quality Assurance Commission, differentiate between the duties of pharmacists, technicians, interns, and pharmacy assistants, identify specific practice settings to pharmacy and the laws of each specific practice setting, discuss dispensing requirements, reference drugs pertaining to each of the 5 schedules in the Controlled Substances Act, list means of protecting patient information, and describe how technicians may avoid disciplinary actions. These subjects will be covered through a 7-part series of learning. Session 1. Session 1 will cover the Pharmacy Quality Assurance Commission. In Session 1, the objectives include classifying the members of the Washington State Pharmacy Commission, explaining the powers and duties of the Pharmacy Quality Assurance Commission, and reviewing the fundamentals of Washington State laws. Pharmacy law is set individually at the state level. State to state, there are great variations in individual laws and pharmacy practices. While the DEA and FDA set federal policy, the most common daily functions of a pharmacy are dictated by state practice laws. This highlights why the Washington State Pharmacy Quality Assurance Commission wanted to make sure that pharmacy technicians who are entering practice in Washington State have a strong understanding of the laws they will be practicing under, and therefore why you are going through this 8-hour training course before you enter practice. If you've practiced in other states, some nuances to look for in comparison with those other states include the scope of practice of a technician, assistant, pharmacy intern, and pharmacist. Also, the handling of controlled substances may vary state to state, the requirement for tamper-proof prescription pads, CE requirements for technicians, and other nuances that you may pick up on that are different from states you practiced in before. In the summer of 2013, Washington State transitions from having a Board of Pharmacy to having a Pharmacy Quality Assurance Commission. This is based on a law change during the 2013 legislative session. We will discuss the Pharmacy Quality Assurance Commission exclusively in this series from here on out. We will refer to the Pharmacy Quality Assurance Commission simply as the Commission or Pharmacy Commission to simplify things. Pharmacy regulations are developed and interpreted by the Commission. The Pharmacy Commission is made up of appointed members as well as paid staff members. The members of the Pharmacy Commission are appointed by the Governor. The executive officer is the chief staff member of the Commission and is hired by the Commission. They report to the Undersecretary of the Department of Health for Health System Quality Assurance. Other staff members of the Commission are employees of the Department of Health and the Health Professions Quality Assurance Division. Investigation of pharmacies and complaints to the Commission are carried out by pharmacy investigators. These investigators are drawn from a pool of other investigators within the Health Professions Quality Assurance arm of Department of Health, but are themselves licensed pharmacists. Individual professional license fees and pharmacy license fees are paid to the HPQA office. The Commission is made up of 15 members who are appointed by the Governor. The members include 10 pharmacists who have been licensed in Washington for at least 5 years, are citizens of the U.S., and residents of Washington State. They should also represent the geographic diversity of Washington State and a variety of practice settings. In addition to the 10 pharmacists, there are positions for 4 public members who are not affiliated with any aspect of pharmacy practice, but do need to be citizens of the U.S. and a resident of Washington State. And there is also a single slot for a pharmacy technician member of the Commission. The terms for a Commission member are 4 years in length, and a member may serve up to 2 terms, or a total. The Commission is charged with regulating the practice of pharmacy. They will set qualifications for licensure of pharmacists, interns, and pharmacy ancillary personnel, which includes pharmacy technicians and assistants. The Commission reviews the applications for licensure. The Commission sets out requirements for licensure of pharmacists or interns and register pharmacy ancillary personnel. They can also put on hold or deny a license, which often will need a hearing to potentially be reactivated. The Commission also reviews medication and medical device dispensing, distribution, wholesaling, and manufacturing to ensure that quality and safety for the consumers of Washington State. The Commission approves continuing professional education and ensures that pharmacy professionals meet their continuing education requirements. We will discuss the nuances of these at a later time. The Pharmacy Commission has the power to issue subpoenas, which are requests for information, help law enforcement, work with other state and federal agencies, and also has police powers for law enforcement. Throughout this course, you will see reference to RCWs and WACs. It is important to know the difference between these. RCW stands for the Revised Code of Washington and is a list of laws that our representatives in the legislature have voted on. WAC, or the Washington Administrative Code, are the rules that have been put in place. Often these rules guide implementation or enforcement of the laws. The Commission, with stakeholder input, will establish WACs pertaining to the practice of pharmacy. It can be difficult to understand how rules and laws interact, so I wanted to paint a picture of this through an example. The legislature had passed a law, which is listed as RCW 18.64A.020 1A33. It says that pharmacy technicians shall complete continuing education requirements established in rule by the Commission. Nothing in this law states how much CE is to be required for technicians, what type of CE it must be, how often the technicians must complete it, etc. It simply says that the Commission may establish rules around technician continuing education. To see the level of detail you need to actually put this into practice, you would have to look at the WAC 264-901-061, which is titled Pharmacy Technician Continuing Education Requirements. This chapter outlines in great detail what the Commission will require of a technician for CE credits, including how much, what type of CE, who may approve the CE, and so on. We will review the actual requirements for CE later in the course, but I thought this illustrated how the law just simply gave the Commission the power to make a rule, and then the rule fleshed out exactly what that requirement is.